To have all of you, a communal welcome to Morning Live. This is just it's a fantastic success story because in and amongst all the heartache and suffering, this is a beacon of massive hope to those that have HIV and AIDS and getting that treatment and fast.
So Themba Lethu Clinic actually stemmed out, was one of the first clinics. We've been running HIV services here at the hospital for almost 2 decades, but it was Madiba's intervention with the cabinet that actually got almost to this day, 10 years ago, that got the cabinet to move and start antiretroviral therapy rollout. And Themba Lethu Clinics was one of the first to start. This is a hub of innovation. We try out many new things. You've heard about the automated pharmacy this morning, but we also have databases running that enable us to research in depth into the progress and outcomes of our treatment program. My colleagues here, in fact, run the research unit, which is a prospective research unit looking at new drug development, new diagnostic development, which is, again, a university handshake. So now BITS University is involved together with the hospital and Themba Lethu Clinic and Right to Care in this triumvirate, if I could call it that enables us to provide really important information on treatment, of the future of treatment.
Now, Pauline and I have overheard a conversation that the two of you were having, was saying that you've actually been at this clinic for 12 years now. Is that correct?
Yes, I started working with Ian at Johannesburg Hospital. We were running HIV clinic. And then when we moved to the research unit, I moved with him because I had identified some of the good things that the research has been doing. We started off with few patients that we're doing research on, and those patients, we saw some improvement. And as a nurse who have been running the clinic, I was so depressed at that time because all the patients that were coming, I saw them depreciating right in front of my eyes. And with the research, I saw some improvement with the patient. And then what do we do? And what is our secret weapon as the nurses of this unit? We recruit patients from all over, and especially it's a referral clinic. And what do? We strive for excellence, and we promise our patients that we are going to be there for them all the time, and we are keeping that, and we promise that we are going to love them, and we love them, and that is our most secret weapon because we love them, and we want to retain them in the study, and as we retain them in the study, we are contributing as much to the scientific agenda, which is research, and as the unit that is affiliated to NIH with ACTG is our sponsor. And we have tried our level best because we're striving for excellence. We tried our level best to take our unit up to the international level. As such, we are internationally recognized and we love our patients. We are passionate with what we do. And we've got our secret weapon as well. Our secret weapon is our counselors. We are involved with counselors. Our counselors, they are involved with the community with the CAB, which is Community Advisory Board. So these people, they go out and they educate the public about the research because when we started with research, people didn't know about it and there were so many myths about it. People were saying that we were making them guinea pigs, and that has now been done with because of the involvement of the community and involvement of us as their people. They see us and we said to them, we promise that we are going to keep our word to you.
Prof, I think this is your secret weapon. I know. She talks about all these secret weapons. I think you're the secret weapon, hey, that we're bringing out here. So nice to see the passion because at the end of the day, you must see a lot. I mean, it's a tough environment to work in. It is because but at the end of the day, there's so much hope that you are giving. So I suppose it's not tough. You're giving people life.
No, actually, it's not a tough job. It's a very, very rewarding job. I wake up every morning and I feel really motivated to come to work because I know I make a difference in people's lives. And in terms of looking at our patients who come in, who are really ill, and they've got no hope whatsoever. Many of them feel they're going to die within the next few months. And 6 months down the line, they are absolutely well. They They're making plans for the future, and that's what we aim to strive. We need people to know that HIV is no longer a death sentence. You know, it's a chronic disease and it can be controlled.
Turning people's lives around. Professor, before I wrap up, because we have to end and go back, I mean, we had an interview with the health minister a bit earlier. Since Dr. Aaron Motsoaledi came in, and I was having a look at Twitter, and so many people raving about him as a health minister. From your experience, how has him coming in changed the face of the way HIV and AIDS is treated in this country?
I think he works with an incredible enthusiasm. That is based down. It's very down to earth. You'll recall that within the health sector strike, he rolled up his sleeves and went to work. When we launched circumcision, he was there actually circumcising, performing circumcisions at Chrisani Baragwanath. I think the dynamic has changed incredibly. I think the right amount of funding has come to bear on the main infectious diseases epidemics of HIV, tuberculosis. Our malaria problem is relatively small compared to our neighbors. But in general, he has revitalized the enthusiasm of healthcare workers. We work closely with the minister and with his team on national costing models for antiretroviral therapy, for TB diagnostics. We have worked closely in research on the Gene Expert, which was the new TB diagnostic that's been launched and distributed around the country. But I think his ability to really take an initiative and say, I want this to happen and I would like it to happen now, has been a godsend, and we wish him all health and hope that he continues in his position.
All right, there you have it. So all the praises and accolades going out to the health minister are not unfounded. I think when you hear from the people that deal with him directly that he is doing a great job, it's good to see, and it's also good to see these tangible benefits that are happening. Professor, thank you for being with us. Professor Ian Sonne is the Group CEO for Right to Care. Pauline Vunandla, is that right? I got it right. Vunandlala. All right, good. The clinic manager here at Themba Lethu, and Dr. Charlotte Faison also working here at Themba Lethu. Thank you very much for being our guest on Morning Live. Let's take a break. When you return, we are going to be speaking to some patients that come here for treatment, and they are willing to talk to us, and we would love to hear from them and what their experience is like coming to Themba Lethu Clinic. Stay tuned.